And we are back. Good morning, everybody. AM Live. I'm Ed Tracy. I'm here with Dr. Rita Kerr.
Good morning, Ed.
Good morning. And you are the Amador County Public Health Officer.
That is correct.
Does that mean you carry a gun?
No, but I do have a badge.
She's got a badge, everybody. All right. So we're going to talk a little bit about what's going on in the county.
Yes.
And you are, how long have you been with Amador County?
I took over as health officer in October from Dr. Hartman, who did it for many years before that.
And how do you like it here?
It's great. Very
Awesome.
busy.
Yeah, I bet. So I just found out that the county has 39,000 residents. Mm-hmm. It's a pretty good-sized county.
It is, although it's considered still one of the small rural jurisdictions in health officer speak because each county in the whole state has a health officer, including the biggest ones, and some of the larger cities have their own health officer as well.
Would you say that, because we were talking about this off the air, you have a clinic?
Yes.
And where would you say the bulk of your patients or the people that come from? Is there a specific area? Is it just all over?
You mean geographically from the county? I don't know if it really is a geographic designation. We really serve a population of people who don't have access to care otherwise because they don't have insurance or they have special needs like families with young children, young mothers who don't otherwise have access to a pediatrician.
Gotcha. Low income, no income?
Yes.
Gotcha. And we were talking a little bit earlier about this. There's a lot of things that you do, obviously. Vaccinations, for flu, TB.
Well, you don't vaccinate for TB, but we test for TB to make sure that if someone has tuberculosis, could be contagious, that they're not going to spread it to others in the community.
Gotcha. The big thing, though, is measles.
Yes.
And tell us a little bit about that and why it's so big now.
Well, back in late December, an outbreak started in the state of California that started at the Disneyland Resort in Anaheim. And Orange County and San Diego counties were the first ones impacted, but it rather quickly spread to Utah and some other counties, even in Northern California and Washington State, because people travel when they come to and from Disneyland.
What was that big, not to change the subject, but there was this big outbreak of something really recently, and they were quarantining people. It was all over the news.
Oh, you're talking about Ebola?
Ebola, yeah, the Ebola outbreak. That's from people traveling, and people traveling to areas where there's Ebola outbreaks.
West Africa.
Doctors getting it and all sorts of crazy stuff. But this isn't quite as large, but it's a serious thing.
Well, in a way, it's very serious because Ebola is very contagious, but you actually have to touch someone who's contagious in order to get Ebola. Measles is even more contagious because if someone simply sneezes in a room, it stays in the droplets in the air, unlike Ebola, which is not transmitted through the air.
Wow.
People could walk into that room, the contagious person may not even be there anymore, and if they're not immune to measles by having been vaccinated, they can still get measles.
Anybody in the county have measles?
So far, no. Thank you.
Yeah, right.
But our goal is that we have enough people immunized, vaccinated against measles, that we prevent it from getting a foothold here and being transmitted from person to person.
And how many people have it right now? You said it was 100?
There's been a little over 100 cases in California so far, and there's currently measles activity going on in 17 other states, Canada, and Mexico.
Wow, that's crazy. Crazy. And what are the complications that come from this? I mean, I remember as a kid, my mom talking about measles and chicken pox and all that. So I think I had chicken pox as a kid, but what are the complications that come from this?
Well, before about 1957, everybody who was born before then is considered immune to measles because it's so easily transmitted and so widespread, and there was no vaccine back then. And so just about everybody got it as a kid. So some people are under the mistaken impression that it's really a minor thing like a cold or, but measles actually can be very serious. During this outbreak, about a quarter to a third of people who've gotten it have had to be hospitalized. It can lead to pneumonia, inflammation of the lining of the brain called encephalitis, and even death. And Roald Dahl, who wrote Willy Wonka and the Chocolate Factory, wrote a really tragic essay in the late 60s because he had a daughter who died of measles before a vaccine was available.
I had no idea it was that serious.
Yes,
I thought it was a kid's disease, you know.
Actually, 60% of the cases in this outbreak have been people over the age of 20, a lot of young adults.
Wow.
And Measles can be more serious in the very young, those under 5 years old, and in adults than it is in the normal childhood years.
Wow, I had no idea.
The crazy thing is that little babies under the age of 6 months cannot be vaccinated. They won't build the immunity. And so really to protect our vulnerable, young, or other people who have an immune problem like cancer on treatment who can't get vaccinated, we rely on the immunity of a whole community in order to prevent that coming in. And so we really are encouraging vaccination. It's available at several local pharmacies, including Raley's, Safeway, Walgreens, and Walmart. Many doctors' offices are able to vaccinate, or we have vaccine at the health department as well.
And this is something, again, that's fairly recent. I mean, we've not seen this in, do they vaccinate on a regular basis for measles anyway?
Yes.
Oh, they do. Okay.
Since the late 60s, they've been, actually since the early 60s, they've been vaccinating. They've been vaccinating with the current type of vaccine since the late 60s. If somebody was vaccinated during the 60s and they're not sure what kind of vaccine they got, they should probably be boosted now. If they've been in the military, they got jabbed while they walked through.
Oh, yeah.
They're vaccinated. People who've attended public school since the 1970 year approximately, unless their parents refused vaccine for them, should be vaccinated and okay.
Can they do that? Can they refuse vaccinations?
Unfortunately, yes. California actually has had a fairly high rate of what they call personal belief exemptions. That became a little tougher to get last year, but we still in Amador County have a fairly high rate of vaccine. Relatively 90% of our kids are vaccinated entering kindergarten. But we sent letters a week or so ago to a little over 200 students that are either completely unvaccinated or haven't had the 2-dose full vaccination schedule.
Wow.
To remind them, think about it.
I think my mother made sure I got every shot. What's that needle over there? Stick that in him. Just give him that one too.
Right.
Yeah. And what's the treatment for that? So if somebody gets measles, it doesn't go away right away.
No, it doesn't. It starts out with fever and symptoms that you think might be influenza or a cold, usually runny eyes, pink eye, cough, runny nose, and then a couple days later, a rash starts on the head, spreading down the trunk, arms, and legs. You're contagious from about 4 days before the rash starts till 4 days after the rash starts. Very contagious.
Wow.
So if you have those symptoms, don't just show up at the emergency room or a doctor's office. Call your provider first so that they can be alert. We can organize testing, and we send that off to a state health lab to be tested and get those results back fairly quickly, usually within a day or two. And stay home, isolate yourself so that you're not spreading it to others. If you've been exposed to someone who has measles, you can actually get some protection by getting the vaccine immediately within 72 hours of an exposure. That way, if you get measles, it probably won't be as severe or prolonged.
But you have to know. That's the thing, you know.
Right.
I mean, it's like, well, like lice, you know, head lice with kids. You don't know, and all of a sudden your kid's, you know, doing one of these, and before you know it, the whole class has got it, you know. And
Right, and that's our worry, that in school, if somebody brings it into a classroom or a daycare center, all those close contacts, we would have to investigate and have those kids actually stay out of school for a few weeks who have not been immunized in order to prevent the spread.
And how do you prevent it, really? Aside from a vaccination, that's pretty much...
Vaccination and staying isolated.